Welcome back, and this is the second part of the third module, and here we will be discussing the routes of fluid therapy. Let's begin. The most commonly used route for administering fluids and even drugs would be the intravenous route, right? But there are other routes your fluid can enter the body. It all depends on how fast you need that fluid to go into the compartment it needs to be, right? So the first is intravenous, subcutaneous, oral or per os, that's why it's called PO, intraosseous, and intraperitoneal, right? So choosing what route to use entirely depends on, number one, the level of dehydration you need to correct and how fast you need to correct that dehydration. Certain parts of the body, which is functional or non-functional, especially with the gastrointestinal tract, how critical the patient is, how fast you need to stabilize the patient, and what fluid you are giving it, right? What kind of fluid it needs, right? So let's discuss the most preferred route of fluid administration, which is the intravenous route, which is indicated for patients with acute or severe fluid loss. The advantages of this would be you're directly placing the fluids where it needs to be, right? Along with fluid administration, putting an intravenous access to your animal makes way for the intravenous medications to work faster, right? You're done with pharma or you're currently taking pharma, you know that placing or administering drugs through the intravenous route would make it, the onset would be faster than any other route, right? Ensures fast delivery of medications, especially for those situations which are emergent or during resuscitation cases. And when you put access to the intravenous space, you can continually collect blood from that IV catheter, but this is only applicable for central IV lines or intravenous access to the external jugular vein. Right? This is also used and advantageous for when you need to infuse continuously a certain drug for sustained effect. This can be done for certain inotropic drugs, vasopressors, dextrose, analgesics, wherein we usually give those drugs as a bolus, meaning every 4 hours, every 6 hours, every 8 hours, but you have this relative time na nawawalan na siya ng effect o nagwe-wane yung effect. And there are some conditions and situations wherein you cannot have that waning effect. You need a sustained analgesia, sustained anesthesia for these patients, and that can only be done through an intravenous route of administration, right? So, what are the conditions which make a patient contraindicated for jugular vein catheterization or even blood stick or blood collection? Jugular vein is one of the best sites for blood collection, but what is a contraindication for that? Patients with thrombocytopenia or very low platelet, those with coagulopathies or problems with the clotting factors, because it will predispose that puncture wound into the vein to not stop bleeding from that hole. Patients with elevated intracranial pressure, which could be from a brain trauma, head trauma, usually those things are contraindicated for jugular vein catheterization, because when you prepare for a jugular vein catheterization, you put pressure into the jugular vein, which further elevates the ICP. Right? The disadvantages of the intravenous route would be, of course, you need technical expertise. And if you do not know yet how to do it, or you're not good in doing it yet, it's fine, because it's muscle memory. Like, for example, I did intravenous sticks to the smallest of patients, like a 350-gram cat, and if you are so used to doing it on a daily basis, you'll be fine. You'll get better, and your muscles won't forget it. But then if you stop doing it for just a few months, your muscle memory tends to forget. my muscle memory is not that good. So it's fine. It just takes practice and knowledge of how you put the IV catheter, the choice between what size of IV catheter to use, and how to handle these patients, right? It is challenging to place an IV catheter for fractious animals, and some might need sedation. This is very true for cats, who tend to be so stressed and tend to bite and scratch. That's what I always say. In handling dogs, I only have to worry about the mouth and the teeth, but with cats, you worry about four paws with claws and teeth, right? That's why handling cats are more of, you need more caution when handling cats, and they tend to be stressed more, right? There are also complications related to intravenous route of administration, embolism, formation of blood clots on that area, phlebitis or inflammation of the vein, the tendency to overload a patient with fluids because the fluid is directly going into the intravascular space, and when certain fluids are administered outside the vein. This is very common when you have an IV catheter and you're not monitoring it regularly, or your catheter is very covered. It's covered with a lot of bandages. For you it's secure, for you it's safe, but then it actually conceals a possible problems with how in your catheter is, and some fluids cannot exit the IV. They will cause problems, tissue problems, cause necrosis, like fluids which have dextrose on them, right? Dextrose laden fluids, even those done as a bolus. If you give them IV, you have to make sure that they remain in the intravenous space. Your needle, your catheter is in the intravenous space, because if it goes into the tissues, that will be a problem because they tend to cause tissue necrosis. All right, what's the other route? Let's go to intraosseous route, IO. This is indicated, number one, for pediatric animals na masyadong maliit yung vein nila for even the smallest catheter to go in. All right. This is also indicated for adult animals na mahirap hanapin yung vein, especially for those which suffered from cardiopulmonary arrest. Right? How we see a vein is we occlude it, right? Para lumitaw siya. And patients without a blood pressure, that won't happen. So you would not be able to distinguish where the vein is from the muscle or from any musculoskeletal structure. They would just feel the same, or they would be collapsed. So you might be in it, but there's no, it's too narrow for you to actually identify it, right? So intraosseous route, one way for those in cardiopulmonary arrest. This is also used in humans as well. They usually go for our tibia. Also, this is the route for fluid administration for wildlife, exotic animal species, especially birds, small mammals like guinea pigs, small rabbits, big rabbits that tend to have a very good auricular vein for IV placement, but those small ones, you go for IO, hamsters, and chinchilla. All right. So where do we actually, what bones are we targeting here? Right? You go for the medial surface of the proximal tibia. You feel for that depression there. Tibial tuberosity, quite adjacent to the patella, the intertrochanteric fossa, the greater tubercle of the humerus, right? Those are the areas to feel for, and they can be palpated from the outside, right? You're not seeing the bones here. Imagine it in the leg. You don't see the bones, but they are very palpable, these anatomical landmarks. Another area commonly used would be the ilial wing and the ischium. Right? So again, needs technical experience, administers fluids and drugs directly into the place where it goes, because it is a very vascular organ, the bone marrow. So basically, really fast, right? So subcutaneous route, SQ or SC, the limiting factor for this is when you choose to use subcutaneous route, you can only use isotonic crystalloids, right? Some would even say you can only use saline, but I've used LRS, and in some articles, LRS was found to sting the least or to be the less painful. All right. So again, it depends on the veterinarian, but my only limiting factor for you is it needs to be isotonic crystalloids with no dextrose supplementation in it. Right. The indications for this would be those patients with just mild dehydration, which can be managed at home. Patients who cannot tolerate IV placement and maintenance, those fractious patients, they tend to be quite aggressive inside a clinic, or they tend to remove their IVs after you place them, right? And those with a relatively stable hydration status, but they cannot tolerate being confined in a clinic. Very common than you might think. Even some clients would say that they would prefer to bring their pets home as compared to having it confined. So this is one choice that you could give them. All right, but make sure, of course, that if you are choosing the route of fluid administration, you have to make sure that it will help the patient and not cause more harm. Because if that patient needs aggressive fluid therapy, kahit anong pilit ng owner na iuwi, you have to be very honest with them as to the consequences that they might be facing just a few hours after taking these pets home. Right? So it takes a lot of assessment of the hydration status, of the health status, of how fast you need to give the replacement fluids, which we'll be discussing later on how you're gonna figure that out. But you have to be very frank with the owners about it, right? So what are you looking for? What sites? These would be the body areas with loose skin. The target would be the dorsal neck. This is the most common site for that. Even for your vaccines, this is where you put it. The flow rate would be 10 to 20 ml per kg per site. All right. And the absorption rate, because you would expect na, for example, a 5 kilo cat would receive around 100 mils of subcutaneous fluid there. Magkakaroon siya ng parang kuba on that area. It will be very palpable. It's a soft lump, and the clients would be like, nagkabukol siya. Yeah, that's the fluid. But that will be absorbed within 6 to 8 hours. So you just tell them, this will be gone at most in 8 hours. So don't worry about it. And that actually tells you how slow the fluids you're giving will work. All right? In intravenous route, automatic, nandun agad siya sa veins. But fluids administered through the subcutaneous route takes a longer time for it to go into the compartment where it needs to be. All right, so this is only for those with mild dehydration and not those who are decompensating because of dehydration. All right, let's not forget the most physiologic route of fluid therapy, which is the oral route. If you need to give certain diets to these animals, which are high caloric density solutions, this is the way to go. It's very safe unless the patient struggles or refuses to eat or drink. Remember, your patients are not, unless your patients stop drinking and stop eating, they won't get dehydrated. Right? If they have good nutrition, good water intake every day, then you don't have to worry about their hydration. However, if they have problems with that, they have an underlying condition, they have a problem with their mouths anatomically, then that is the common cause of dehydration. All right? They don't even have to vomit. They don't even have to have diarrhea to be dehydrated. Just the refusal to eat or drink enough water, because they derive water from drinking water and from the food that they eat. Just refusal for that can render a patient dehydrated. It might take longer than the active losses of vomiting and diarrhea, but it is still possible. right? So if you have patients who are struggling or refusing to eat, if they have anatomical problems in the upper part of the digestive system, then you might need to consider placing an esophagostomy tube, which is a tube that basically you make a hole on the esophagus so that dun papasok yung pagkain. This is what we call tube feeding or something. Right? Indications: malnourished animals which lack fluid and electrolytes, animals with a dysfunctional oral cavity, those with oral ulcers, which is a characteristic clinical sign for patients with kidney problems, those with call this malformations, right? Cleft nose, cleft lip, we call this oronasal fistula, those things, right? And if in large animals with less than 8% dehydration, the usual go-to route would be the oral route. And it is so easy to give large amounts of fluids to large animals because they have a very big capacity in their stomach, especially ruminants. Right? We'll have in your surgery 3, there's a separate topic for fluid therapy in large animals, and that is where we will focus on that. Right? Now, contraindications when not to choose the oral route. When you have vomiting or diarrheic patients, of course, you would expect if you're giving so much through the oral route, it's either they're just gonna throw it back out, or the patients will not be able to absorb it if the diarrhea is caused by malabsorption in the gastrointestinal lining, right? Gastrointestinal dysfunction, loss of motility or hypomotility, patients with acute fluid and or electrolyte losses, which needs a faster replacement rate, right? So you usually just go for IV for that, for those patients, right? The intraperitoneal route or IP, this is more commonly used for drug administrations rather than a route for fluid therapy, right? My experience with this of giving fluids intraperitoneally by placing a catheter into percutaneously, meaning you're inserting a catheter through the abdominal wall, the ventral abdominal wall. You remove the stylet, connect the IV line to it, is when we were trying to resuscitate a cat suffering from severe hypothermia. This cat, ang washing machine sa atin, di ba, sa taas yung bukasan, right? And some washing machines are not manual. Some of them are, you put the clothes there, you close it, it seals, right? And then nakakonect na yung hose dun sa loob ng machine, nalagyan mo na siya ng sabon. And then when it's done, it's dry, right? These are automatic washing machines. And that's the common washing machines used when I was working in Hong Kong. And the thing is, the cat, the owner's cat, thought that the washing machine is a laundry basket, right? So she put the clothes there. The cat went in. She didn't see because she went somewhere to get detergent, I think, if I remember correctly. And she closes it. It seals. She doesn't even see the cat in there, and she starts the washing machine. And then she realizes her cat is missing after 15 minutes, and the cat is swirling inside the washing machine. Its eyes are like muro ami, red already. So she rushes the cat to the clinic where I was working at, and that cat had a low temperature, meaning it's that low that it wouldn't register in the thermometer that we had. So we had to, and she was so feeling guilty, and the nature kasi of people there is that they treat their pets as family. They're willing to spend, they're willing to borrow money, kahit gaano pa kalaki, for their pets. That's why the small animal veterinary industry there is booming, because they treat their animals like human beings. They're willing to spend 300,000 for orthopedic procedures, So she was so guilty. She was telling us, do everything. So might as well. We have warm fluids and isoton. This is saline, warm saline. We always have an incubator where we put the warm saline in. It's kept at the body temperature. We hanged it and then we connected it to the abdomen to further hopefully thaw the cat out from low temperature. Now, that cat, surprisingly, when we did an x-ray, it was so clear. It's like a perfect lung. But then after 2 days, the cat lived for like 5 days. After 2 days, the cat just suddenly suffered from respiratory distress, took an x-ray, took a CT scan, the lungs were white. So it suffered from acute respiratory distress syndrome, meaning everything in its body was on hype. The epinephrine was booming, catecholamines were on high, so everything was, you feel that it's okay in the lung, but then after 2 days, everything just shuts down. Right? So that is the only application for intraperitoneal route for fluids that I have a personal knowledge about. And it has been said that it causes complication, patient discomfort, and peritonitis. But then again, if you are in a cardiopulmonary resuscitation situation, you're not worrying about the complications, because the complication that you're only facing at that moment is death. Right? So the other complications about discomfort and peritonitis, you can address that when it happens. The only thing that you have to worry about is keeping that animal alive. Right? That's why I love emergencies, because it's either they live or they die. I don't have to worry myself about so much medicine. What I fix is what I just face right there and then. I love emergency. Right? So that is it for the routes of fluid administration. We are going to talk about next what causes fluid loss, fluid deficit, what is hypovolemia, what is shock. Right? Let's click on the next video to find that out.